So the Airway and Breathing Clinic aims at providing multidisciplinary care and state-of-the-art care for patients with airway disorders. And those airway disorders include patients with asthma, with COPD, with emphysema, bronchiectasis, and chronic cough, amongst other airway disorders. Our goal is to work with our colleagues at SLUCare from different specialties, and we collaborate closely with allergy and immunology, with ENT, with our speech pathologists and gastroenterologists, and other subspecialties to provide a multidisciplinary care and to provide the best care for patients with airway diseases and breathing issues so that we can help them improve their quality of life, help them perform any activity they would like to do. Sometimes those airway diseases require a lot of attention to the details, and they require a lot of multidisciplinary approach between different specialties to try to address the disease from different angles, to try to better control the symptoms and preventing it from affecting the patient's quality of life. And our goal is not to let their airway diseases be a barrier for them to perform any activity they would like to have on a day-to-day basis or even at any time throughout their life, and prevent them from being hospitalized or having attacks when it comes to asthma and COPD. Patients might come in. First, they'll be seen by our nurse and get certain basic questions answered and get their vital signs checked. After that, we as pulmonologists, either myself or any of my colleagues, will come in. And as an initial visit, we try to take an extensive history from the patient to try to pinpoint what might be causing their symptoms. After that initial visit, we will probably order an initial workup to identify the cause of their symptoms and see if they have any underlying airway disorder. And sometimes we see patients that are coming as a second opinion and they've been diagnosed with asthma or diagnosed with COPD, but we always try to start from scratch and make sure they were diagnosed appropriately and they carry the appropriate diagnosis so that we can provide the best therapy possible.
It's really difficult to provide this attention in a normal busy clinic because these patients have very chronic problems that involve and require a lot of expertise and a lot of time, because when you have a chronic respiratory problem, a lot of the treatment is education and learning about how to best manage and how to understand your problem so that you can manage your problem the best way. We also hope to provide personalized teaching with a respiratory therapist and other tools in the future that allow patients to get much more out of the clinic.
Since we offer a comprehensive approach to airway conditions, such as testing, treatment, and counseling, it's very beneficial to the patient to come in one visit, basically address many issues all at one visit. And mostly the education and the emphasis on smoking cessation, inhaler training, and respiratory exercise.
Our main goal in our airway and breathing clinic is to address the patient concerns and try to improve their quality of care. And we create a certain goal for each treatment between us and the patient themselves. So the patient is at the center of developing the treatment goals. And we work closely with the patient to try to figure out, okay, they have asthma or they have COPD. What are reasonable goals to achieve when it comes to treatment? Some patients with asthma, young patients, their goal is to continue running a marathon. We can provide that, and we can work with the patient closely, adjusting their therapies so that they can continue to exercise the way they want to exercise or perform the activities they want to perform without having their diseases limit them in one way or the other.